Hello, everyone, and welcome to the final CAQH Core Town Hall for 2017. My name is Jessica Porras, and I'm the Senior Manager for Education and Outreach at CAQH Core. I'd like to mention a few logistical items. You'll be able to download a copy of today's presentation from the caqh.org website tomorrow. In addition, a copy of the slides and the recording will be emailed to you in the next day or so. We'll save time at the end of today's program dedicated to responding to your questions. You're encouraged to submit your questions at any time during this webinar by typing them into the questions panel on your dashboard. As you can see from this slide, we have a lot to cover during this town hall. We will start off with a CAQH core overview, followed by a federal activity update. Then we will share the latest on our mandated and voluntary work, such as the Phase 3 CAQH core maintenance activities for code combinations and enrollment, core certification, prior authorization, attachments, and value-based payments. So let's get started. I would like to introduce our first speaker, CAQH Core Director, Bob Bowman. Bob?
Great, thanks, Jessica. And as you can see, we want to move directly into the next slide, where you'll see that with the specific mission that CAQH Core has of driving in the creation of specific healthcare operating rules and also their adoption through our vision of an industry-wide facilitator to bringing different diverse groups together to develop those rules. And we do that through our integrated model for the industry. And this wheel keeps turning, right? We keep cycling through and developing phase by phase different sets of operating rules to ensure that the industry moves forward through that development of a specific sustainable healthcare data exchange meeting the market needs, right? It's a very specific methodical process that we use. And so we want to share with you today really what the status, what those updates are, that, as Jessica mentioned, on where we're at and where we're going. Part of that, though, is really going to be based on, if we can move to the next slide, on who makes up CAQH Core. And that really is, again, making sure that we can develop a set of operating rules that are crucial and part of the healthcare delivery system today. And as you can see here from the quote from Susan Tierney, it really is this responsibility and role that each of us play, each actor in the transaction of data. It's really important understanding those roles and responsibilities. And who better to understand that than the organizations that make up our membership at CAQH Core, with over 130 organizations that represent every major stakeholder type, from providers to health plans to clearinghouses to health plans as well as clearinghouses and vendors, excuse me. Core is in a great position to ensure that we bring everyone to the table to develop those operating rules. As a recap on the next slide, for what we've accomplished to date in 2017, we will continue and have continued to serve as the federally recognized National Operating Rule author. We have completely supported the industry in their adoption of phases 1, 2, and 3. We've continued our maintenance efforts for phase 3 as well. We also work with, and we'll have more of an update in just a moment on our federal activities, all dealing with HPID, the NCBHS Predictability Roadmap, the ONCISA, also the updates to X12 for their version 7030. All of those things have been very important for us this year and will continue to be important to us in the future. Also important for us this year is the continuation of the development of operating rules with phase 4. We've rolled out that phase last year. The implementation support has been available this year. We actually have certification seals that we've been able to publish, and we'll have more of that also later on today's call on who those entities are that have recently completed phase 4 certification. We're also working to develop operating rules on prior authorization as well as attachments, and looking at value-based payments as that model becomes more and more popular and more interesting to the industry. We also work as a function as the effective voluntary certifier. As I mentioned, we have some recent phase 4 certifications. We continue to see major stakeholders becoming phase 1, 2, and 3 certified. We've also updated our enforcement policy to ensure that as entities consider certification, they ensure that their vendors, their clearinghouses, their health plans are also that we're enforcing the policy and the requirements for that certification that entities have gone through. Again, we are continuing to evolve and support our mission and vision, and we hope that with your support, we'll continue to do that. With that, I'll hand the call over to Erin for the federal update.
Great, thank you, Bob. I'm going to spend a few minutes talking about some new updates on the mandated operating rule compliance side. The first begins on slide 10, where I want to talk about the HHS Health Plan Certification of Compliance. Some of you may remember that the Section 1104 of the Affordable Care Act did include requirements for health plans to certify their data and information systems are in compliance with transaction standards and operating rules. In 2014, HHS did issue a notice of proposed rulemaking around that health plan certification requirement. They received quite a few comments on that, and that NPRM was never finalized. In October of this year, so just 2 months ago, HHS published a notice withdrawing that 2014 Health Plan Certification of Compliance NPRM. So at this point, there are no regulations existing related to health plan certification for compliance with the mandated standards and operating rules. However, health plans must still, by regulation, comply with the HIPAA mandated standards and operating rules for electronic transactions. And HHS does retain the authority to review health plans for compliance, and we'll talk more about that in a second. So with the withdrawal of the NPRM, there was a new announcement from CMS, moving to slide 11 now, around their HHS HIPAA Administrative Simplification Optimization Project. So at the end of November, CMS announced that HHS will be pursuing proactive compliance reviews of health plans and clearinghouses for compliance with administrative simplification transaction standards, which includes adopted standards, code sets, unique identifiers, and operating rules. The stated goal was that compliance reviews would result in an environment that required minimal government intervention because entities are conducting electronic transactions in adopted standard formats. The CMS announcement emphasized that there were quite a few benefits of this approved approach, including reducing the burden of exchanging health information with organizations that are not compliant with the standards and improving efficiency across the systems. They noted in their announcement that they would take a proactive approach and implement a progressive penalty process with the goal of remediation, not punishment. However, they noted the full array of enforcement actions are possible, which include corrective action plans and HHS technical assistance. In the announcement, they noted that the first step in this process is a pilot project, and the pilot will inform the rollout of the proactive compliance review program for health plans and clearinghouses. So the next slide talks a little bit more, shares a little bit more detail about the pilot, which CMS plans to launch in January. They are currently seeking 6 volunteers, ideally 3 health plans and clearinghouses, to undergo reviews of their transactions for compliance. The volunteers would submit electronic transaction files for review and testing and attest to compliance with the operating rules. During the pilot, HHS will identify any compliance issues and work with volunteers to develop a corrective action plan if there are areas of non-compliance. Volunteers will then receive a report and a certification that they have achieved successful review. So again, this pilot will inform the rollout of future proactive compliance reviews in the industry. HHS is seeking volunteers to email them by tomorrow, December 13th, and we'll make a decision by the end of the year regarding volunteers for the pilot, which will roll out again in January. So there's an email address here if you are interested in participating in that. And my colleague, Taha Anjawala, will talk in a few minutes about specifically about the attestation to compliance of operating rules and what CAQH core and core certification can do to assist with your conformance with the operating rules. A few other activities that have been happening in the federal arena, I want to highlight the National Committee on Vital and Health Statistics, which is the advisor to the Secretary of HHS on issues related to HIPAA. The standards subcommittee of that group has been working on a operating rule and standards predictability roadmap with a goal to establish a predictable schedule to the industry of when updates to the HIPAA standards and operating rules will occur and to help the market prepare for change. CORE has been participating in this project throughout 2017. There was an in-person workshop in August to generate ideas and opportunities, and there is a follow-up call this week with key stakeholders to discuss next steps for that work. Additionally, earlier this year, there was some testimony provided to NCVHS on the health plan identifier landscape and current use. The final item I want to highlight coming at the federal level is through the Office of the National Coordinator, which is the federal entity charged with the nationwide coordination of health IT efforts. They publish annually a interoperability standards advisory, which is a coordinated catalog of standards and implementation specifications that can be used to meet interoperability needs in healthcare. The 2018 ISA is the first time that administrative transactions and operating rules are going to be included in the ISA. And so we very much support the inclusion of these administrative functions in the guide for industry's access. They did have a comment period which closed on November 20th, and we did submit comments which you can access on our website, specifically around how the operating rules were organized and presented, the value of including the Phase 4 operating rules, and a few other key points. So that is a great tool if you're looking to understand kind of what your options are in terms of standards and implementation specifications for both clinical and administrative interoperability. With that, I'm going to turn it back over to Bob to talk a little bit about X12 7030. Bob?
Great, thanks, Erin. And we do want to provide an update to you on the X12 7030 public comment period. This is something that we've been trying to provide an update on throughout the year because the cycles have been going throughout the year as well. So we want to make sure you understand exactly where we're at, where the industry's at when it comes to version 7030. As you see, cycles 1 through 4 have already come through and have been completed. The cycle 5 is current and is going on today, right now. So the industry has the ability to review the version 7030 TR3 implementation guide for the 278 transaction or for the prior authorization transaction. That will stay open until January 31st of 2018. You'll see later that we are continuing our review of the TR3 as well, and we'll engage with the core participants if there are any particular comments that we need to submit as an organization. But the TR3 is currently under review by the industry. Cycle 6 and Cycle 7s have been postponed without dates yet of when those TR3s will be available. It's assumed that it'll be sometime soon after the 278 closes in January. So that's where the industry is at today for the review of the TR3s. If we can go to the next slide, you'll see that there's very specific functions that we have been taking place throughout the year in regards to the public comment period with very specific milestones that we will engage and enact here at CAQH Core every time that a new set of TR3s are made available for public comment. Again, we are working very closely with our core participants to make sure that if there are anything that kind of bubbles up to the surface that we need to make them aware of, we do have a process in place to do that. We will engage them. We hosted a call in May. In June of this year, they announced launch of the public comment periods for cycles 5 and 6. In August, there was another announcement that there was a delay in the 270, 271. In September, the 278 was extended through January of next year. So we are trying to maintain a very clear focus on the actions that we need to take as the public comment period process continues at X12. If we move on to the next slide, this section, we do want to provide an update to you on the mandated operating rules that are in place today, the maintenance process that we have. And that maintenance process is specific to the Phase 3 EFT and ERA operating rules. So on the next slide, you'll see that there are 3 rules that are impacted by our current maintenance process, and these are ongoing maintenance processes. Every year we walk through a very specific cycle and process as we maintain the integrity of the operating rules for very specific reasons. And we'll go through those reasons for each of these in just a moment. But we look at the core code combinations for the Rule 360, and then both the data maintenance rules for Rules 380 and 382. The next topic, I want to drill down just a little bit into the core code combinations maintenance process on the next couple slides. And we'll look at, there are 2 reasons that trip this particular process here at CAQH. The first is every time that the updated standards code lists are updated, and that happens 3 times per year, the core code combinations task group is engaged, and they complete what we consider a compliance-based review. And they go through that maintenance process 3 times per year. It's a well-oiled machine, and that process takes place it seems like every day, but it takes place through every 3 times per year. The industry needs also triggers what we call and consider a market-based review. Our market-based review usually kicks off in December. So on December 20th, the industry will be receiving basically a hyperlink to continue our market-based review process. I think this will be our 4th or 5th one that we've done since the rules were originally drafted. And this will allow the industry to, again, look at the current code combinations and see if they're meeting your business needs. Do there need to be changes made? Do we need to add new codes, remove old codes that aren't working for you, or do we need to just make adjustments, move codes around in some way for those code lists for the core code combinations? And so that process, again, will take place in December 20th. You'll receive your notification. The entire industry gets that, and the entire industry has the ability to submit updates if you use the transactions, if you use the 835 transaction. If we move to the next slide, you'll see that we are also ensuring that the code combinations for the market-based survey, again, are meeting your business needs. And what that means, again, is that any entity that does use the transactions or transmits the transactions can submit comments for the market-based review. It does ask you to not only come up with how the code combination or the potential code combination fits the 4 core defined business scenarios, but also if there's any particular adjustments that you need to be made. It also asks you to include any sort of usage data. We also term this like real world usage data. You keep seeing these same clunky codes coming from specific health plans, and you need to make them better. It's every time you get this particular code combination, it means you have to pick up the phone and call the plan, or you have to go out to their website and try to better understand exactly the reason for the adjustment or the denial. So the best thing to do is let us know about those more complex or more difficult code combinations, complex issues that you're having with those code combinations for a market-based review, and we can help work with the industry to make those code combinations better. Again, it is a 60-day open period, so we'll launch Wednesday, December 20th, with a close of March 2nd. So we will work as the task group does at reviewing those particular code combinations that are submitted for review. So the entire industry gets to review, but the task group, the core participants that work on the task group, will review all the submissions. Moving on to the next maintenance process, and this is the process that we have for the enrollment data sets. Again, this is a specific set of data that is used to allow providers to enroll for the EFT transaction or the ERA transaction by a health plan. Again, very specifically, the rule does impact the ability, we hope to make it much easier for providers to enroll for these transactions with health plans. Again, electronic submission of the data, very specific definition around the data. The providers understand exactly what they have to provide to each of the health plans, so it makes it easier if they want to enroll with multiple health plans. Again, we look at the industry at large. The participants in our task group, they help us understand what's going on from their perspectives. And we go through either a limited review 1 year or a comprehensive review that year. And this year we did complete a review of the data. We asked our task group to assess the data the enrollment data sets for both, and with some very interesting findings that we can look at on the next slide. From the task group, we had a very high percentage of participants from the task group respond to the survey. Again, from a very wide, diverse group of stakeholder types, both in plans, providers, clearinghouses, as well as SDOs and government responses as well, and with some very significant findings. Nearly 90% of the respondents indicated that the enrollment data sets are working fine as they are today. Key benefits realized were that folks are actually seeing increase in the enrollment for EFT and ERA, as well as it being much more consistent and accurate data. So there's less of the back-end rework that health plans have to do on their end, because the data is coming in much more consistently than it had in the previous, before the forms, before the data sets were implemented. Also, the respondents agree that the 2-year cycle that we have in place, both with the 2 different types of reviews, the limited review and the comprehensive review, is also working, with over 75% of the respondents saying that this cycle is working as well. So really significant findings from our latest survey. With that, I'll hand the call over to Taha and Jarwala for our voluntary course certification update. Taha?
Thanks, Bob. So good afternoon, everyone. So today I'll be providing you all with an overview of the certification program, highlighting some of the key benefits and also some of the recent program updates that we made. So as a program, voluntary course certification is really the gold standard in how a certification program should be developed and administered. This slide outlines the elements that make up the checks and balances, which make certification unique. First, the certification program was developed by industry, for industry, through a transparent multi-stakeholder process. Second, the certification program not only requires adherence at a policy level, but also actually requires organizations to validate conformance via system-based testing through a third-party testing vendor. And third, CAQH Core serves as a nonprofit neutral administrator of the certification program, reviewing and validating testing results, checking for any trading partner dependencies, and conducting a comprehensive application assessment before awarding a core seal. These 3 elements are the foundation as to why the core certification program is the gold standard in the industry, and as the value of the core seal gives confidence to organizations as they have gone through industry-driven, comprehensive, non-biased, and independent review processes to assure adherence to the operating rules and underlying standards. So moving on to the next slide, we're happy to announce that we've awarded a total of 333 core seals, and with the most recent certifications including Humana, WorkComp EDI, PocketDoc, Delta Dental California, and Texas Medicaid. So congrats to these organizations, to all organizations that have gone through core certification. And I'd also like to note that was mentioned earlier on today's call that some of these organizations are actually phase 4 pioneers. In looking at the impact that core certification has on the nation's healthcare system, and measuring the amount of covered lives that benefit from core certification. For phase 1 and phase 2, 76% of the commercially insured and 44% of the publicly insured are covered by core certified health plans. And for phase 3, we see adoption is definitely growing, with about 27% of the commercially insured and 25% of publicly insured plans are covered by certified plans. So this data reflects the momentum of certifications in the industry and the increased commitment and the mounting success of all healthcare players to effectively share electronic data in a secure and meaningful way, creating the efficiencies that administrative simplifications have provided. So moving on to the next slide. Each phase of the CAQH core operating rules have unique tangible benefits that aid in improving the business processes of healthcare. Core certification helps to call out and make transparent to those organizations in the marketplace that are able to deliver and maximize on those benefits afforded by the operating rules. Some of the benefits for phase 4 include improvements in revenue cycle management, such as the ability to quickly learn the adjudication status of claims after submission, and also reduction in phone calls for checking the status of claims or prior authorizations or even enrollment queries. Spending less time on the phone helps both payers, providers, and also employers to focus on more critical administrative tasks. If you would like to learn more about the phase 4 operating rules, their benefits, and also hear from implementers of these rules, we are hosting a webinar next week featuring our phase for pioneers, which include Humana, PocketDoc, and WorkComp EDI. So you can contact us to get a registration link, or this link will also be available on the slides when they are sent out. So moving on to the next slide. One great benefit of the certification program is that each phase builds off the other. So as you implement and certify on one phase of the operating rules, you can leverage your past efforts to implement and certify future phases of the operating rules. Each phase of the operating rules, phases 1 through 4, shares a common set of infrastructure requirements that apply across each transaction, including requirements around connectivity, security, response time, system availability, companion guides, and acknowledgments. Thus, if you implement one phase, you've already created a foundation that will help streamline implementation of subsequent phases. So this slide kind of provides an overview of the Phase 4 certification testing portal, which is designed to build off the user and testing experience from past phases. Testing is conducted by an authorized testing vendor and helps organizations validate that their conformance to Phase 4 requirements. Then moving on to the next slide. Many of the reasons why entities get core certified are based on the idea that there's an objective testing proving whether your organization is conforming to operating rules and standards as they're meant to be used. That is, as a way to find efficiencies in the administrative costs of healthcare. Certification, testing, and the issuance of a core seal helps give organizations assurance that they comply with federally mandated operating rules and standards, and allows their organizations to feel more confident in the event of an audit. In essence, it's like using TurboTax, going to H&R Block, or a third-party accountant to help file and submit your taxes. It's good practice to find somebody outside of your organization to check your work to make sure you did it right. And core certification is that kind of check for the operating rules and standards. Certification helps organizations prepare for potential compliance reviews and audits, and it's through its comprehensive certification testing and application process. Core certification is positioned to help organizations assess and validate operating rules and standard implementation in preparation for the HHS Administrative Simplification Program compliance reviews that Aaron had mentioned earlier. So as part of our outreach efforts for next year, moving on to the next slide, we have worked to build industry awareness of the core certification enforcement policy. And this was due to the large footprint of core certified entities now in the marketplace, and that organizations across the data exchange should be seeing the benefits afforded by the operating rules. And we want to ensure that there's ongoing monitoring of compliance in the industry by all trading partners. As a component of certification, the enforcement policy has always existed, and core certified entities must adhere to the policies in addition to the operating rule and testing requirements in order to become certified. This enforcement policy applies to any core certified entity, including certified plans, vendors, clearinghouses, and providers. So to help organizations orient and navigate themselves through the certification enforcement process, we have created a webpage with tools and resources to help with engaging in enforcement conversations with non-compliant trading partners. So as an example, if you believe you have one of your trading partners is non-compliant with the operating rules, we actually have a letter template available to help you start a collaborative dialogue with your trading partner to help facilitate collaborative remediation efforts. If you have any questions related to the core and certification process, feel free to reach out to us, and we'd be glad to set up some time to talk to you. With that, I think that's the end of the presentation certification. I'm going to turn it over to Jessica for our polling question.
Thank you so much, Taha. So now we're ready to hear from you, our audience, to get some feedback. As you heard earlier in the town hall, Aaron presented on the new HHS pilot program, and Taha just talked about core certification. So we would like to hear from you whether the CMS announcement regarding the compliance reviews with the adopted standards and operating rules, how that influences your plans for pursuing core certification. So let's launch the poll. The options are: you're more likely to pursue core certification. Your plans have not changed. That's option 2. The third option is unsure, need more information. We know this information from CMS is brand new, so you might still be processing what this means. And then 4, you're already core certified, so you are good to go. So let's give this a few more seconds we are going to use this information for our planning efforts for next year. So we really value your feedback. So let's give this 3 more seconds and then we will close the poll and continue with the town hall. Thank you very much. And now we will move on to our presentations focusing on our voluntary work to drive industry value. For our next presentation on CAQH Core's work on prior authorization, I would like to introduce CAQH Core Manager, Rachel Goldstein. Rachel?
Thanks, Jessica. Hi, everyone. So I will be speaking about our work on prior authorization. We can go to the next slide. While prior authorization seeks to manage healthcare utilization by requiring approval for certain medical services and prescriptions, we know that the process is burdensome to stakeholders, including providers, health plans, and patients. CAQH Core seeks to introduce targeted change to propel the industry collectively forward to a PA process that is optimized by automation, which will reduce burden on providers and health plans and improve timely delivery of patient care. The Phase 4 CAQH Core operating rules establish the critical infrastructure for electronic information exchange related to PA requests and responses. The rule sets expectations on response time, acknowledgement of receipt of the request, real-time and batch processing requirements, amongst other foundational requirements. This was an incremental step for the industry and offers real implementable system improvement. Given strong core participant interest, support from our board, and CVHS's recommendation to continue to build additional PA operating rules, and significant industry interest, CAQH Core is now working on building on the basics established with these Phase 4 rules. Here you'll see a timeline of much of our efforts over most of 2017 heading into 2018. CAQH Core launched an advisory group in November 2016 with the goal of identifying high priority opportunity areas for potential operating rules. All major stakeholder types were represented in the advisory group, including health plans, providers, government, and vendors. The advisory group kicked off by reviewing a draft list of potential opportunity areas compiled by CAQH Core staff. The list was developed via thorough review and analysis of X12 version 5010-278, the TR3 technical review, National Committee on Vital and Health Statistics on CVHS testimonies, industry surveys from CAQH Core, industry forum discussions and initiatives, and CAQH Core Phase 4 subgroup discussions. The advisory group then conducted an environmental scan to identify barriers to adoption of electronic PA methods and overall pain points with the process. Finally, with support from the advisory group, CAQH Core narrowed down the list of potential opportunity areas by applying our knowledge from the environmental scan findings and funneling the opportunity areas through rigorous evaluation criteria. The opportunities that rose to the top are shown on the next slide. The top 6 opportunity areas seen in the white boxes on this slide fall into one of 3 buckets: data content, attachments, or additional documentation, and research on potential best practice workflows. We are using an incremental approach to pursuing each of these. The CAQH Core Prior Authorization Subgroup, which launched in October 2017, is focused on identifying potential rule options for the data content opportunity areas you see here. These 2 areas, robust data content requirements for the HIPAA mandated 278, and uniform and consistent robust data sets for initiating a PA via other methods, were consistently the highest ranked. This subgroup will consider ways to enhance data content, with the goal of seizing opportunities to make information clearer. Our attachments-related opportunity areas will be incorporated into our overall attachments initiative, which you'll hear more about later in this presentation. We will further research these opportunity areas during an attachments environmental scan in preparation for an advisory group to further consider. Finally, on the far right, you'll see workflows-related opportunity areas, which will be further researched by CAQH core staff and partners throughout 2018. Next slide, please. Here is a high-level view of the CAQH core prior authorization subgroup's roadmap into 2018. This is really our biggest focus right now in prior auth, and we're deep in our development. We're currently in our feedback, submission, and discussion period. This entails asking our subgroup participants, which is about 50 organizations, including providers, health plans, associations, government, vendors, and clearinghouses, to provide feedback that will help inform development of detailed rule options for the subgroup to choose from. Following the selection of rule options, the subgroup will begin to draft the rules and will review and iterate until Q2 2018. We utilize straw polls along the way to obtain feedback and gain consensus to move forward through our milestones to get to the draft rules. The subgroup's next call is January 11th, 2018 from 2 o'clock to 3:30 p.m. Eastern Time. And during that call, the subgroup will review rule options to enhance data content for the 278, specifically relating to ways to reduce errors in processing and ultimately intents and denials of the request due to challenges with provider identification, patient identification, and procedure codes. In addition, the subgroup is considering rule options related to the Healthcare Services Review Decision Reason Codes and AAA Reject Reason Codes in order to enhance that communication regarding reasons for pending denial. If your organization is impacted by challenges surrounding prior authorization, we certainly encourage your participation in the subgroup, especially now as we develop these potential rules. I'll pass it to Jessica now for our related polling question.
Thank you so much, Rachel. So this is the second opportunity during our town hall to get feedback from our audience. As Rachel just walked us through our work on prior auth, we think that one of the benefits of becoming a core participant is being able to participate in drafting operating rules from the ground up to solve problems such as the problems we've heard about on prior authorization. So here's the polling question. Let's go ahead and launch it. The polling question is, are you or your organization interested in participating in our subgroup on PA? So the first option is yes, please reach out to me. Second option is unsure, I need more information. 3, I'm already participating in the PA subgroup. And the fourth option is no, not at this time. So we are going to take a few seconds to collect some information from you.
And one thing I would note, this is Rachel, is that we're especially looking for provider organizations to join the subgroup. We want to make sure that the provider voice is heard during this time. So if you are a provider organization, we certainly encourage you to reach out to us. Joining a subgroup is open to all core participating organizations. So if you are not a core participating organization, we also encourage you to reach out to us so that we can start having that conversation to see how to best get you involved.
So great. Let's go ahead and quickly show the results. And the reason I'd like to show the results is simply to let you know that for some of you who clicked the first 2 options, we will be following up with you, and we appreciate this so that we can continue to work together on this important issue. So let's close the poll, and let's continue the town hall with a presentation on our work on attachments. Once again, with our presenter, Bob Bowman. Bob, whenever you're ready.
Great, thanks, Jessica. And on the next slide, you'll see that we are launching our work on attachments. And to give you a better definition of what the scope of that work is, similar to what we've done with prior authorization, as Rachel mentioned, when we launched that particular project, we did an environmental scan. We're really at the beginning of that process for attachments, and we have launched our environmental scan. And what that means is that we've been continuing to monitor the trends in the transactions that are used, how providers are submitting attachments, how health plans are receiving attachments, the vendors that are in that space. We're really looking at what's going on. We're doing that through site visits. We'll come to a specific location at a provider site to see how providers are doing it. We log and track. It's a half-day process or a full-day process in some cases, where we are really looking at the models that they put in place, the business processes that have been put in place, the systems that they're using, the way that providers are submitting and conducting attachments, and everything that means, right? Either for a claim, for prioritization, for an audit, for remittance processing, for anything that takes place after the claim has been filed, for example, for grievance and appeals. All of that process is what we look at for our site visits. We also do that for stakeholder interviews. If we can't make a site visit work, we'd like to do an interview with you as well. And a lot of our interviews, we talk with vendors and clearinghouses, folks that have applications or systems or software in place in the market, and they want to share what their product is, what it does, and how it's being positively impacting the provider workflow. So we have that interview process as well. We also have a vendor product assessment that's a little more specific. It is a complete, like a who's who of vendors that are in this space, that they have penetration in certain markets or certain spheres or certain geographies. And that's what we're looking for the vendor assessment. So all of that parts of that environmental scan are taking place now. We have been and will continue to continue our education series on attachments. We've had 3 so far, with our 4th one actually coming up January 18th. And so these have been really well attended. The industry is really interested in what is going on when it comes to attachments, both with the technology behind it in regards to standards, in regards to connectivity, in regards to security for the data, as well as what is the best place for me to be at when it comes to attachments. It is a significant burden for providers and for health plans to process paper today, and they are still processing millions and millions of sheets of paper today. Whether that's from an actual paper being mailed in an envelope to an e-fax process that they have set up, it's still manual touch all along the way. So we hope in 2018 we will be launching our advisory group to review the results of our environmental scan and push the industry and push the core participants into looking at specific topics that can be addressed through operating rules, through continued industry education, through lessons learned, and through any other publication that can help the industry tackle this particular troublesome and burdensome topic. We also, and with that, we can actually go to the next polling question. And Jessica, I can set this one up as well, similar to what Rachel did. We do want to know if you are interested in participating with CORE on our environmental scan for attachments. It's a quick yes, no, maybe you need more information. But as I detailed, it really is like a one-hour phone interview. We have a form that we can send out beforehand where you'll collect data from either your health plan, if you're a vendor, a software clearinghouse, if you're a provider. We want to talk to every stakeholder type to get a really well-rounded perspective. But we want to make sure you have enough time to commit to it as well, because it does take some research, may do some analysis on your part, because we have a one-pager that we send out that have lots of questions on it that we want to make sure we get those answers to. So we'd love to have you participate. We want to make sure that it's productive for everyone. Again, if you're interested in site visits, interviews, or filling out the form or survey, all of that's to come. We want to make sure that we get you engaged. So with that, we'll open up the polling question. And Jessica, I'll hand the call over to you now. Thank you.
Thank you so much, Bob, for setting up this polling question for us. So it's pretty straightforward. Are you interested in participating in the CAQH Core Environmental Scan on Attachments? 3 simple answers: yes, no, need more information, and a heads up that we will be following up with you depending on your response, the yeses, and then need more information. We really do think that the more people involved in this work, the more robust results and recommendations we'll have. So let's give this a few more seconds. And I think what we'll do is we'll close the poll in a few seconds and keep going with our town hall, and we'll use this for our follow-up and planning efforts. So let's go ahead and close the poll. Thank you very much. Our next presentation is on our work on value-based payments, and I will hand it back over to Erin Weber. Erin?
Thanks, Jessica. I just want to wrap up today's town hall call with a brief update on the work that we are doing in the area of value-based payments. On slide 46, I want to highlight that our focus for the value-based work is to identify some of the operational capabilities that are essential to support the industry shift from volume to value. We are seeing an increase across the industry in participation in various VBP models. And I say various because there are quite a few. And it is expected that more than half of healthcare payments will be value-based by 2020. That said, the transition to VBP is not without its challenges, and in particular, improvements in operational capabilities are really needed to ensure success. Organizations are implementing VBP based on pre-existing systems and unrefined processes, and there is a risk that the industry is setting itself up to repeat some of the same mistakes from the fee-for-service model early days. If providers are encountering barriers, particularly around the operational components, it could slow this volume to value transformation and reduce the total benefit to the industry. So it's really important that we collaborate now and apply some of the lessons learned we learned from fee-for-service to ensure this transition continues unimpeded by administrative hassles before proprietary systems and processes become entrenched. CAQH Core has undertaken some research and study on the next slide to identify some of these operational challenges. And traditionally, CAQH Core has been focused in the fee-for-service model. We have demonstrated our role as a change agent to reduce the administrative burden in the fee-for-service area. This expertise and experience will help us support the development of a sound operational system for VBP. We've had proven success. More than 76% of commercially insured and 44% of publicly insured individuals are now covered by health plans that have certified their use of the current operating rules. We've seen significant improvements in fee-for-service as a result of the work that CAQH and its participating organizations have done. We have a history of industry collaboration. We represent more than 130 organizations, and we have experience from developing the operating rules for the administrative areas and demonstrated the ability to harmonize practices between providers and health plans. And the time is right to apply some of these experiences now into value-based payment operations. So we have done quite a bit of research, interviews, site visits, and are in the process of developing a report outlining some potential areas for action in value-based payments on slide 48. In particular, there are 5 opportunity areas that kind of rose to the top, and we are working on a report really detailing these areas, outlining the province-based opportunity areas and recommended strategies to address the opportunity areas. In some instances, it may make sense for CAQH to do some of the work. In other areas, there are other organizations and partners who are focused on making improvements in value-based based on these topics. So looking at data quality and standardization, provider and patient attribution, patient risk stratification, infrastructure interoperability and best practices, and quality measurement. All of these came through as operational areas for efficiency in our research and outreach. So let me talk a little bit about the timeline for this work. To date, we have conducted, on slide 49, quite a bit of research to identify the opportunity areas. As I mentioned, primary and secondary research, surveys, and industry interviews. We have launched a VBP educational series with partners to help the industry understand some of the benefits and challenges of these payment models. upcoming, we plan to release the report in early 2018. Also in January of 2018, we have our next educational event. It's a partnership webinar with CMMI, which will be talking about some of their alternative payment model experiences. And we will ultimately be launching a BBP action group charged with furthering the recommendation and strategies identified in the report. So we look forward to sharing quite a bit more on this initiative with you all in 2018. With that, I believe I will be turning it back over to Jessica to wrap things up.
I was on mute. Thank you so much, Erin, for that presentation. We wanted to remind people what the benefits are to become a core participating organization, what kind of benefits you will receive for joining us. As I mentioned earlier during one of the polling questions, you get to participate and be a leader in the development of rules. Also, you help us figure out how to track and measure ROI in the work that we do in order to help the industry. Finally, we have a lot of, participating organization-only content that we share with participants and hope to do more of that next year. So if you're interested in becoming a core participant, please contact us. Since the more, the better. And now we have a little bit of time for Q&A, so let's go on to the next slide. We have received a few questions already, and if not, please ask your question in the questions panel. For the first question, we did receive a couple of questions saying that people were interested in the PA subgroup, but wanted a little bit more information on what type of resource, how much time and resource that work would entail. So Rachel, would you please respond to that question?
Yeah, absolutely. It's a great question. So from January until about May, we have about 7 calls scheduled, and the calls are an hour and a half and have very structured agendas. And the ask is that you just read the materials prior to the call, engage in discussion, and then a couple times from now until May, we'll send out some straw polls that will help us gather consensus from the group. So it's not too much of a time commitment, and really the goal is to not add too much to your workload, but still allow for these structured opportunities for you to have your voice heard. So if you want any more specific information about that, please don't hesitate to reach out to us.
Thank you so much, Rachel. So again, if there are any other questions, let me see what we've got here. I do see a few people were just asking for reminders of when the deadline was for that CMS compliance review pilot. Taha, could you remind us what that deadline is once again?
Yep. So the deadline to volunteer for the HHS Administrative Simplification Pilot Program is tomorrow, December 13th. And if you'd like to volunteer, you can email HHS at HIPAA-compliant@cms.hhs.gov. And the deadline again is tomorrow.
Thank you, Taha. So I think we've run out of time for today. If there are any other questions or you'd like to provide feedback, you know how to reach us either by email or by phone. Here is information on the next slide about our upcoming webinars. We're really excited about our programming in December and early next year. And on the next slide is just a thank you for joining us. And there is some information about our website and our email so that you can contact us if you have any questions or comments. Thank you very much. Have a good afternoon.